we know how hard it is to keep up with the changes to the learning disability nursing service within adult care service and know what we can help with. So here's a speedy overview of the Community Learning Disability Nursing Service within Herts County Council Adult Disability Service and 0-25 Together Service. Meet some of the Community Learning Disability Nurses. Community Learning Disability Nurses, CLDNS, sit in 5 disability locality teams in the East, 5 disability locality teams in the West, and the 0-25 Together service. The nurses work with people who have learning disability, a health need, and who are experiencing barriers to be able to access mainstream health services. They work to reduce the health inequalities faced by people with a learning disability and bridge the health inequality gaps that may lead to misdiagnosis or delays in treatment without their specialist support. Meet the Health Liaison Team. We have additional roles to work with their community nursing colleagues across all community teams in a connected lives model to achieve the best health outcomes for people with a learning disability. Meet the Clinical Lead Nurse. They operationally manage the people in the Health Liaison Team and have clinical oversight for the whole nursing service, including the community nurses in the 0-25 service. Part of the role is also to ensure joint strategic planning with nursing and social care. Meet the Acute Liaison Nurses. They are based in both Watford General Hospital and the Lister Hospital and cover all the West Herts Hospital Trust and East and North Herts Hospital Trust hospitals. When someone is admitted to hospital, their role is to ensure the hospital staff know how to work with them, overcome the barriers, support with mental capacity, and link with care providers and family. If someone is having a planned admission, then the community nurse or social worker can also link with them to help plan for successful admission. Meet the Health Improvement Prevention or HIP nurses. These general nurses support the service by working with people who have complex physical health to reduce the risk of avoidable admissions to hospital. Meet the Epilepsy Specialist Nurses or ESNs. The incidence of epilepsy is higher for people with learning disabilities, and this is often difficult to control. Epilepsy Specialist Nursing Service is a team of learning disability nurses with expertise in the care, management and treatment of epilepsy. The ESNs work collaboratively with the community learning disability nurses and offer support and guidance in the management of cases. Where the case is complex, it will be managed by the ESN. They will also work with other health professionals like GPs, neurologists, and learning disability consultant psychiatrists via the Learning Disability Epilepsy Clinics. Alongside their clinical role, the epilepsy specialist nurses deliver epilepsy training aimed at empowering clients, their carers, and family members with the safe management of epilepsy. Meet the Health Equality Nurses for Cancer Screening. These nurses work with each GP practice to identify people who have missed cervical, breast or bowel cancer screening. They will then work with those individuals and their carers to look at the barriers to this screening. If you know that someone has missed their screening, please do contact the nurses. Meet the Health Equality Nurse team for STOMP. STOMP is the Stop the Over-Medication of People with Learning Disabilities. The STOMP team are working with GPs to ensure that people who have been prescribed antipsychotic medication have had a thorough, detailed review to make sure they still need it. The STOMP team work with the person and their carers, make safe reductions where possible. Meet the Health Equality Nurses for annual health checks. The annual health check nurse makes contact with all GP practices to work with those hard-to-reach people and identify what the barriers are to them accessing primary health care and embed reasonable adjustments to enable future access. If this contact identifies safeguarding or general well-being concerns, the nurse may refer to the adult disability team for a joint visit. Meet the Purple Star team. They support GP practices across the county to overcome the barriers to equitable health outcomes by making reasonable adjustments, addressing leader recommendations and improving the quality of the annual health checks, and making sure that the health check action plans that are produced from this give the person and the people that support them monitoring tasks to do at home. These are all on a tool called the Stay Healthy at Home checklist and has all the tools from our nurses' webpage that can be used to keep an eye on someone's health. If you want to promote these health at home tools, then there's a link in the description below this video to the Stay Healthy at Home checklist. Thank you for watching, and I hope you have enjoyed this video. If you need to contact us, please look to the description below this video for our details there.